Welcome to a mini series of tutorials focused on collagen treatments. So as someone that's in their mid-30s, collagen is something that I think about a lot because from the age of 25 onwards your natural collagen production starts to decrease. So it's something that I've been looking into recently because you can have the treatments that attack from the outside in, and you can also take supplements that can work from the inside out, based on the fact as well that genetics play a part, the way that you choose to live your life, your diet, your exercise. So this first video is focused on a treatment called Forma, sometimes called FractoraFirm, and it's by an excellent doctor called Dr Nicola Willis, who's based in Troon and has a beautiful practice. So she will actually talk us through the treatment on myself, and she's so thorough and easy to follow with this that you'll see it better than I ever could describe it, so I hope you enjoy watching.
Hello, I'm Dr Nicola Willis and I'm a consultant anaesthetist, but I have a very busy practice here in Ayrshire doing aesthetics. Now what I'm going to talk to you today about is Forma. Now Forma is a form of radiofrequency treatment that produces heat. Now what we know as doctors is if you heat up skin, skin will contract. Now when we get older, we lose collagen, lose elastin, and your skin tends to drop literally on the skeleton of your face. It kind of gets thinner. So if you can treat it in a way that causes it to thicken up a little bit in a nice way, and also to contract, then you can reverse some of the signs of aging. So what we do is we use a machine here, Forma. It's a radiofrequency producing machine to just gently, carefully heat the skin. Now the temperatures we're going to are about 43 degrees. Now I know that sounds quite hot, and it is, and if you were to touch it you'd think too much, but you do it gradually in such a way that you don't notice that it's that hot. The important thing is here though to impart enough energy. Now we measure it in kilojoules. The important thing is to get it hot enough for long enough, which means that you get 10 kilojoules per area on the face, about the size of your hand. If you do that once a week, 8 weeks, that is usually enough for a treatment for somebody. Now Elaine here is a bit younger and perhaps doesn't need as much. You'll see this. We'll just focus on the face today. You can actually tailor it depending on your patient's needs. But what we know is that you get contraction if you heat skin immediately, but then over time, as your skin reacts to this heat treatment, it will produce more collagen and elastin and it will start to slowly contract. It's fantastic. There are many different ways you can do this to your skin, but radiofrequency remains the safest and the best known technology. So we know that it's very precise, doesn't go too far. So it's perfect for treating the face where you would worry. And so I'll just get started. Just gently moving it around your face, like this. Now the beeps you can hear are there as an audio aid to the person doing this to tell them that the cut-off temperature has not been reached. What you'll hear is they get a bit faster. The closer to the temperature we get. As long as you keep it moving. Uses electricity as well, but it stimulates your targeting muscle. And in fact we know that the skin on your face drops because the skin itself is thinning and losing collagen, losing elastin. It's not necessarily the muscles underneath it, although there's no doubt that keeping your facial muscles fit does help. But this is one step beyond it. So we'll just keep going. I'm going to put up the energy that we're using. Just gradually increase. Keeping in. You hear that? So they're getting closer together. So that means your skin temperature is approaching 38 degrees. So we'll go a wee bit higher. We're up to 40. So you'll feel the difference, making sure there's enough gel. And we're going to go in big sweeps at the side here to contract that part of the skin on the side of the face that lifts up the face and addresses the jawline. Now so far, you hear that? Getting closer together again. do. All the way up to the top here, 62 joules. We're nearly at the maximum. To make sure we go nice and fast, but not too fast, because you do want to make the skin hot. Round about the eye, careful. Up to the temple, and round about the mouth. You lift off. There we go. How does that feel?
It's lovely. Nice and relaxing.
It's very relaxing. So we've got one more temperature bit to go. So we're now at 43 degrees, 62 millijoules, and we're aiming to impart 10 kilojoules of energy into an area the size of a hand. And that has been shown to have the best effect in rejuvenating the face and contracting the skin. The beauty about this is you can never actually do too many. You know, there are some people, as I say, a course of 8 is usually all you really need for a full treatment and to see the effect. But there are many people who come here and have this treatment done pretty regularly, 1 month, after the first course of 8. So we want to stick here, and we actually make sure that you move the hand piece so that it's always flat against the skin. You've got to follow the contours. So in essence, although it's quite a straightforward technique, it takes a lot of practice.
It feels so smooth when you're doing it.
Sometimes it's quite good to focus more of your time on areas that really need done, because to be honest your neck looks fine. But we'll do some there anyway, but I'll focus most of it on your face.
Excellent.
So I haven't gone back down to the original temperature, I've just stayed up because you're tolerating it very well. You can feel it's hot though, can't you?
Yeah, it feels hot, but it never, even though you're saying how hot it gets, it just feels so comfortable.
It's nice. It's incredibly effective. I'll do a section under your chin just so that we can show you, but really there's not a lot of point in doing the whole neck thing for you because there isn't an issue there. The best way to balance your skin is by yourself. You know, so removing all the sebum and all the oils from the skin is not a good idea.
Right.
And it looks immediately a bit fresher because it's had water pumped into it. So we don't do as much on the head. Make sure it's lots and lots of gel.
And is that again just because of the surface?
It's because the skin is much thinner on the forehead. You don't have much padding underneath there. But it's actually quite good to tighten this up too over time. The brows can drop. I could do with that. So you can hear that's heating up quite quickly. That feel okay?
It does. So we filmed that 2 weeks ago, and I have to say that everything that Dr Nicola said was true. There was no recovery, it didn't hurt, even though when you look back you can see the erythema in the skin. It's happening so gradually that it actually feels lovely. I wouldn't call it on par with sunbathing, but in the sense that when the sun hits your skin, it's such a subtle, gentle build-up of heat that I can believe that a lot of people would actually fall asleep having it done. So absolutely no ill effects on the skin. That was only an isolated treatment just to really trial it out for our channel, but I can completely understand why people would maintain having this done weekly or as regularly as their expert would advise. I really do think it's something that will have benefits, especially when someone as knowledgeable as Dr Nicola is telling you the reasons why you're having it done, specifically where you need to focus your treatments on. It's also good when they tell you what you don't need to focus on. To me, that's always a sign of someone that has your best interests at heart. So you can see the details for Dr Nicola's practice and her YouTube channel in the description below. and I can honestly say that it's something that I will be looking forward to getting possibly in the near future. I think that I'm on the stages to needing it, and I think I'm fortunate that it's going to be much more of a preparation rather than having to deal with something that I've allowed to progress. So I think I'm going to go down the prevention route, and I look forward to having this done again.